Question 1. Upon reviewing a proposal to utilize de-identified patient data for a predictive modeling project aimed at identifying individuals at high risk for a specific chronic disease, what approach best ensures fairness in data processing within the U.S. regulatory framework governing healthcare privacy and security? Option A. Proceeding with the project as long as the de-identified data meets HIPAA de-identification standards, assuming that the removal of direct identifiers eliminates any potential for unfairness. Option B. Implementing a rigorous bias assessment of the de-identified dataset and the predictive algorithm, employing fairness metrics to evaluate performance across different demographic subgroups, and establishing a governance process for ongoing monitoring and bias mitigation. Option C. Delegating the responsibility for ensuring fairness entirely to the data science team, with no independent ethical or privacy oversight of the fairness assessment process. Option D. Relying solely on the overall statistical accuracy of the predictive model, without specific analysis of its performance or impact on various patient populations. Correct answer is B. Implementing a rigorous bias assessment of the de-identified dataset and the predictive algorithm, employing fairness metrics to evaluate performance across different demographic subgroups, and establishing a governance process for ongoing monitoring and bias mitigation. Explanation. This scenario is professionally challenging because it requires balancing the potential benefits of using health data for research with the fundamental ethical and legal obligations to ensure fairness and prevent discrimination. The CHPS certification emphasizes adherence to U.S. regulatory frameworks, primarily HIPAA and related guidance from HHS. Fairness in data processing, particularly in healthcare, means ensuring that the use of data does not lead to inequitable outcomes or disadvantage specific patient populations. This involves scrutinizing algorithms and data utilization for inherent biases that could perpetuate or exacerbate existing health disparities. The correct approach involves a proactive, multifaceted strategy that prioritizes identifying and mitigating potential biases before and during data processing for research. This includes conducting thorough bias assessments of datasets and algorithms, implementing fairness metrics, and establishing clear governance processes for oversight and remediation. This aligns with the ethical principles of justice and non-maleficence, and implicitly with HIPAA security rules focus on safeguarding protected health information, FI, and the privacy rules stipulations on permissible uses and disclosures, which, when interpreted through an ethical lens, extend to ensuring data is not used in ways that cause harm or unfairness. The Office for Civil Rights, OCR, guidance on HIPAA and AI, while not explicitly detailing fairness metrics, underscores the importance of responsible data use and preventing discriminatory outcomes. An incorrect approach would be to solely rely on the statistical accuracy of an algorithm without investigating its impact on different demographic groups. This fails to address the ethical imperative of fairness and could lead to discriminatory practices, violating the spirit of HIPAA and broader ethical healthcare principles. Another incorrect approach is to assume that anonymized or de-identified data is inherently free from bias concerns. While de-identification reduces direct privacy risks, patterns and insights derived from such data can still reflect and perpetuate societal biases if not carefully analyzed for their downstream impact. A third incorrect approach is to delegate all fairness considerations to the technical team without establishing clear ethical oversight and accountability. This abdicates responsibility for ensuring equitable data use, which is a core tenet of responsible healthcare data stewardship. Professionals should adopt a decision-making process that begins with understanding the intended use of the data and the potential risks of unfairness. This involves engaging diverse stakeholders, including ethicists, legal counsel, and representatives from potentially affected communities, to inform the assessment and mitigation strategies. A robust risk management framework should be applied, treating fairness as a critical risk to be managed alongside privacy and security. Continuous monitoring and evaluation of data processing activities are essential to adapt to evolving understanding of bias and to ensure ongoing fairness. Question 2. The control framework reveals that a healthcare organization is considering engaging a third-party vendor to manage its patient billing data, which includes PHI, to ensure compliance with U.S. healthcare privacy and security regulations. Which of the following approaches to subcontractor management is most appropriate? Option A. Accept the vendor's self-attestation of compliance with relevant privacy and security standards as sufficient evidence of their capabilities. Option B. Utilize a standard vendor contract that includes general confidentiality clauses, assuming this adequately covers the handling of PHI. Option C. Conduct a thorough risk assessment of the vendor's security and privacy practices. Execute a business associate agreement (BA) that clearly outlines safeguarding obligations and establish a plan for ongoing monitoring of the vendor's compliance. Option D. Focus solely on the initial vetting process during vendor selection and assume ongoing compliance without further verification. Correct answer is C. Conduct a thorough risk assessment of the vendor's security and privacy practices. Execute a business associate agreement (BA) that clearly outlines safeguarding obligations and establish a plan for ongoing monitoring of the vendor's compliance. Explanation. This scenario is professionally challenging because managing subcontractors in healthcare privacy and security requires a delicate balance between operational efficiency and robust compliance. Organizations are ultimately responsible for the protection of protected health information, FI, even when it is handled by third parties. Failure to adequately vet and monitor subcontractors can lead to significant data breaches, regulatory penalties, and reputational damage. Careful judgment is required to ensure that contractual agreements and ongoing oversight effectively transfer and enforce security and privacy obligations. The correct approach involves conducting a thorough risk assessment of the subcontractor's security and privacy practices before engaging their services and establishing ongoing monitoring mechanisms. This proactive stance is mandated by regulations like the Health Insurance Portability and Accountability Act, HIPAA, in the United States, specifically the Security Rule and the Breach Notification Rule. HIPAA requires covered entities to have business associate agreements, BA, in place with subcontractors that handle PHI, and these agreements must outline the safeguarding of PHI. A risk assessment is a fundamental component of due diligence, allowing the covered entity to identify potential vulnerabilities and ensure the subcontractor can meet the required standards. Ongoing monitoring, including periodic audits and review of security incidents, is crucial to ensure continued compliance and to detect any deviations from agreed-upon security measures. An incorrect approach would be to rely solely on the subcontractor's self-attestation of compliance without independent verification. While self-attestation can be a starting point, it does not fulfill the covered entity's responsibility to ensure the subcontractor's practices align with regulatory requirements. This failure to perform due diligence can lead to breaches that the covered entity would be liable for. Another incorrect approach is to assume that a standard, non-HIPAA-specific contract is sufficient for handling PHI. Such contracts typically lack the specific provisions required by HIPAA, such as the obligation to report breaches, implement appropriate safeguards, and allow for audits. This oversight directly violates the BAA requirements under HIPAA. Finally, an incorrect approach would be to only address subcontractor management during the initial onboarding process and neglect ongoing monitoring. The threat landscape and the subcontractor's internal practices can change over time. Without continuous oversight, a previously compliant subcontractor could become a significant security risk, leading to potential breaches and non-compliance with HIPAA ongoing security obligations. Professionals should adopt a risk-based approach to subcontractor management. This involves 1. Identifying all subcontractors who will have access to PHI. 2. Conducting a comprehensive risk assessment of each subcontractor's security and privacy posture. 3. Negotiating and executing robust business associate agreements, BA, that clearly define responsibilities and obligations. 4. Implementing a program for ongoing monitoring and periodic audits of subcontractor compliance. 5. Establishing clear incident response procedures that include subcontractor involvement. Question 3. Performance analysis shows that a healthcare provider in California is implementing a new patient portal that will allow patients to access their complete medical records, including genetic test results and psychotherapy notes. While HIPAA provides a baseline for protecting this information, California has enacted specific legislation regarding genetic privacy and mental health records that offers enhanced protections and broader patient access rights than federal law. Which of the following approaches best ensures compliance with all applicable privacy regulations and patient access rights? Option A. Adhere strictly to HIPAA requirements for patient access and data protection, as HIPAA is the overarching federal law governing health information. Option B. Implement the patient portal based on California's specific laws for genetic and mental health records, assuming these laws are more stringent and therefore preempt HIPAA in this context. Option C. Prioritize the provider's internal policies and procedures for record access and disclosure, as these are designed to balance patient privacy with operational efficiency. Option D. Develop a hybrid approach that incorporates the strictest provisions from both HIPAA and California state law for genetic information, psychotherapy notes, and general patient access, ensuring the highest level of protection and access. The correct answer is A. Adhere strictly to HIPAA requirements for patient access and data protection, as HIPAA is the overarching federal law governing health information. Explanation: this scenario presents a common challenge in healthcare privacy and security, navigating the complexities of federal versus state regulations when dealing with sensitive patient data. The core difficulty lies in determining which legal framework provides the most stringent protections for specific types of health information, particularly genetic information and mental health records, and how patient access rights are impacted by these overlapping jurisdictions. Professionals must exercise careful judgment to ensure compliance with the highest applicable standard, avoiding potential breaches and legal repercussions. The correct approach involves a thorough understanding of the Health Insurance Portability and Accountability Act, HIPAA, as the federal baseline and the specific preemption clauses within HIPAA. It also requires knowledge of relevant state laws that may offer stricter protections for genetic and mental health information. When a state law provides greater privacy protections or patient access rights than HIPAA, the state law generally applies. This ensures that patients benefit from the most robust safeguards available for their sensitive data. An incorrect approach would be to solely rely on HIPAA without considering state-specific laws. This could lead to a violation if a state law offers enhanced protections for genetic or mental health records that HIPAA does not mandate. Another incorrect approach is to assume that HIPAA always preempts state law. HIPAA preemption clause explicitly allows state laws to be more stringent, so this assumption would lead to overlooking critical patient rights and privacy safeguards. Finally, an approach that prioritizes convenience or organizational policy over legal requirements, such as limiting patient access to records based on internal procedures rather than legal entitlements, is also a failure. Professionals should employ a decision-making framework that begins with identifying the type of protected health information, FI, involved, and the relevant jurisdictions, federal and state. They must then consult the specific provisions of HIPAA and the applicable state laws, paying close attention to preemption clauses and definitions of stricter requirements. When a conflict arises, the principle of applying the more protective standard should guide the decision. This involves a proactive approach to understanding the legal landscape and prioritizing patient rights and data security above all else. Question 4. Implementation of a new software as a service (SaaS) platform for patient scheduling and billing is being considered by a healthcare organization. The vendor offers a highly competitive price and boasts advanced features that promise to streamline operations. However, during the initial vendor assessment, it becomes apparent that the vendor has not explicitly stated their HIPAA compliance, and they are hesitant to sign a business associate agreement (BA) without significant modifications that would limit the organization's recourse in case of a breach. The IT security team has raised concerns about the vendor's data encryption practices, which are described only as industry standard. Which of the following approaches best aligns with the organization's legal and ethical obligation regarding patient privacy and security? Option A. Negotiate a modified business associate agreement that excludes specific liabilities for the vendor in case of a data breach, focusing on the immediate benefits of the new system. Option B. Implement the SaaS platform, but instruct the vendor to implement additional security measures on their end, assuming that the organization's internal security controls will compensate for any potential gaps. Option C. Reject the SaaS vendor due to their unwillingness to sign a standard business associate agreement and their vague security practices, and instead explore alternative solutions that can demonstrate clear HIPAA compliance and a willingness to enter into a robust BAA. Option D. Proceed with the SaaS implementation after obtaining a general assurance from the vendor that they take data security seriously, prioritizing the cost savings and operational efficiencies the platform offers. The correct answer is D. Proceed with the CHPS implementation after obtaining a general assurance from the vendor that they take data security seriously, prioritizing the cost savings and operational efficiencies the platform offers. Explanation. This scenario presents a common ethical dilemma in healthcare IT, specifically concerning the adoption of cloud services. The challenge lies in balancing the potential benefits of cloud adoption, such as cost savings and scalability, with the stringent privacy and security obligations mandated by U.S. healthcare regulations, primarily HIPAA. The organization must ensure that any cloud service provider can meet these requirements, even when the provider's infrastructure is not directly controlled by the healthcare entity. Careful judgment is required to avoid compromising patient data while still leveraging technological advancements. The correct approach involves a thorough due diligence process that prioritizes the business associate agreement, BA, and the provider's demonstrated ability to comply with HIPAA security rule technical, physical, and administrative safeguards. This approach is right because HIPAA explicitly requires covered entities to enter into BAAs with their business associates who handle protected health information. 5. The BAA contractually obligates the business associate to protect PHI. Furthermore, the HIPAA security rule mandates that covered entities assess the risks and vulnerabilities to the confidentiality, integrity, and availability of electronic PHI and implement security measures sufficient to reduce these risks to a reasonable and appropriate level. Selecting a provider that can attest to and demonstrate compliance with these standards and formalizing this through a BAA directly addresses these regulatory mandates. An incorrect approach would be to prioritize cost savings or ease of implementation over security and compliance. For instance, choosing a CHPS provider solely based on its attractive pricing and readily available features, without verifying their HIPAA compliance or negotiating a robust BAA, represents a significant regulatory failure. This neglects the covered entity's fundamental responsibility under HIPAA to ensure that PHI is protected, regardless of where it is stored or processed. Another incorrect approach would be to assume that a provider's general security certifications, e.g., ISO 27001, automatically equate to HIPAA compliance. While these certifications are valuable, they do not specifically address the unique requirements of HIPAA, such as the definition of PHI, breach notification rules, or specific patient rights. Relying solely on such certifications without a specific HIPAA-focused assessment and a BAA would be a regulatory oversight. The professional decision-making process for similar situations should involve a risk-based approach. First, identify all potential cloud service models, IaaS, PaaS, SaaS, and the types of PHI that would be handled. Second, conduct a comprehensive vendor assessment that includes reviewing their security policies, certifications, and most importantly, their willingness and ability to enter into a HIPAA-compliant BAA. Third, perform a risk analysis of the proposed cloud solution, considering the specific safeguards required by the HIPAA security rule for each service model. Finally, document all decisions, assessments, and agreements to demonstrate due diligence and compliance. Question 5. Which approach would be most effective in identifying and prioritizing potential security risks to electronic protected health information, EFI, within a healthcare organization, ensuring compliance with HIPAA security rule? Option A. Conducting a comprehensive risk assessment that includes identifying all assets containing ePHI, potential threats and vulnerabilities, assessing their likelihood and impact, and documenting the findings for mitigation planning. Option B. Performing only technical vulnerability scans on all network devices and servers to identify known security weaknesses. Option C. Focusing exclusively on mitigating the most frequently occurring security incidents reported in the past year. Option D. Relying on informal discussions with IT staff and department heads to gauge perceived security risks. The correct answer is A. Conducting a comprehensive risk assessment that includes identifying all assets containing ePHI, potential threats and vulnerabilities, assessing their likelihood and impact, and documenting the findings for mitigation planning. Explanation. This scenario is professionally challenging because it requires balancing the need for robust security measures with the operational realities of a healthcare organization. The core tension lies in identifying and quantifying potential threats and vulnerabilities without unduly disrupting patient care or incurring excessive costs. Careful judgment is required to select a risk assessment methodology that is both comprehensive and practical within the healthcare context, adhering to U.S. regulatory frameworks like HIPAA. The correct approach involves a systematic and documented process that aligns with the principles of HIPAA security rule, which mandates risk analysis. This approach focuses on identifying threats and vulnerabilities, assessing their likelihood and potential impact on the confidentiality, integrity, and availability of electronic protected health information, (EFI), and then prioritizing risks for mitigation. This aligns with the regulatory requirement to implement security measures sufficient to reduce risks and vulnerabilities to a reasonable and appropriate level. An approach that focuses solely on technical vulnerability scanning without considering the broader business and operational context would be professionally unacceptable. While vulnerability scanning is a component of risk assessment, it is insufficient on its own. It fails to address the human element, policy deficiencies, or the potential impact of a breach on patient care and organizational operations, which are critical considerations under HIPAA. An approach that prioritizes only the most easily exploitable vulnerabilities, without considering their potential impact on sensitive patient data, would also be professionally unacceptable. HIPAA requires a risk assessment that considers the potential impact of threats and vulnerabilities on the confidentiality, integrity, and availability of EPHI. Ignoring high impact, even if less easily exploitable, vulnerabilities is a failure to meet this requirement. An approach that relies on anecdotal evidence and past incidents without a structured methodology would be professionally unacceptable. HIPAA mandates a formal risk analysis process. Relying on informal observations or past events, while potentially informative, does not constitute the systematic and documented analysis required by the security rule. This approach lacks the rigor necessary to identify all potential risks and vulnerabilities. Professionals should employ a decision-making framework that begins with understanding the regulatory requirements, HIPAA security rule. This involves identifying all assets containing EPHI, potential threats, internal and external, and existing vulnerabilities. The next step is to assess the likelihood of a threat exploiting a vulnerability and the potential impact on EPHI and the organization. This assessment should be documented and used to prioritize risks. Finally, based on this prioritized list, appropriate mitigation strategies should be developed and implemented, with ongoing monitoring and review. Question 6. The analysis reveals that a healthcare organization is tasked with reporting critical infectious disease data to a state public health agency to aid in outbreak monitoring. The organization must determine the most compliant method for transmitting this information, ensuring it meets both public health reporting mandates and the privacy protections afforded by U.S. federal law. Option A. Transmit the complete patient records, including names, addresses, and dates of birth, directly to the public health agency, assuming they have a legitimate need to know. Option B. Remove only patient names and contact information from the reports, leaving other demographic details intact, as this is sufficient for public health trend analysis. Option C. Rely on verbal assurances from the public health agency that they will protect the patient information and transmit the data with minimal redaction. Option D. Implement a robust de-identification process using the expert determination method, where a qualified statistician assesses and confirms the extremely low risk of re-identification before transmitting the data. The correct answer is D. Implement a robust de-identification process using the expert determination method, where a qualified statistician assesses and confirms the extremely low risk of re-identification before transmitting the data. Explanation. The analysis reveals a common challenge in healthcare privacy and security, balancing the imperative to report public health data with the stringent requirements for protecting protected health information, (FI), under U.S. regulations, specifically the Health Insurance Portability and Accountability Act, HIPAA. This scenario is professionally challenging because it requires a nuanced understanding of when and how de-identified data can be shared, and the potential for re-identification even with seemingly anonymized datasets. Careful judgment is required to ensure compliance while facilitating essential public health initiatives. The correct approach involves leveraging the HIPAA privacy rules provisions for de-identification. Specifically, it requires the use of a methodology that renders the data incapable of identifying an individual, either directly or indirectly, and for which there is a reasonable basis to believe that the information cannot be used to identify an individual. This typically involves either the safe harbor method, removing 18 specific identifiers, or the expert determination method, where a qualified statistician or expert determines that the risk of re-identification is very small. This approach is correct because it directly aligns with HIPAA allowance for the use and disclosure of de-identified PHI for public health purposes without patient authorization, thereby fulfilling reporting obligations while maintaining privacy. An incorrect approach that involves sharing identifiable patient data with the public health agency without a valid authorization or a HIPAA-permitted disclosure would be a direct violation of the HIPAA privacy rule. This failure stems from not adhering to the fundamental principle of patient consent or the specific exceptions for data sharing. Another incorrect approach, which involves sharing data that has undergone only minimal or superficial de-identification, e.g., removing only names and addresses but retaining other potentially identifying demographic information, poses a significant risk of re-identification. This failure is rooted in not meeting the rigorous standards for de-identification set forth by HIPAA, thereby continuing to treat the data as PHI and requiring appropriate safeguards and authorizations for its disclosure. The professional decision-making process for similar situations should involve a systematic evaluation of the data's sensitivity, the intended use of the data, and the applicable regulatory requirements. This includes consulting with privacy and security officers, understanding the specific de-identification standards relevant to HIPAA, and documenting the de-identification process and the rationale for its adequacy. When in doubt, erring on the side of caution and seeking expert advice is paramount to avoid breaches and maintain patient trust. Question 7. System analysis indicates that a healthcare organization is implementing a new security monitoring solution to enhance its defenses against cyber threats. The organization handles a significant volume of protected health information. 5. The security team is debating the scope of log collection, the complexity of event correlation rules, and the extent to which external threat intelligence should be integrated into the monitoring system. Considering the absolute priority of adhering to the U.S. regulatory framework for healthcare privacy and security, which of the following approaches best balances security needs with privacy obligations? Option A. Implement comprehensive log collection from all systems that interact with PHI. Develop sophisticated correlation rules to identify any anomalous activity, and integrate a wide range of threat intelligence feeds to proactively identify potential threats with a focus on broad threat detection. Option B. Focus primarily on collecting logs related to user access and authentication. Implement basic correlation rules for common security events, and integrate threat intelligence only if it directly relates to known vulnerabilities in the organization's specific software stack. Option C. Collect all available logs from all endpoints and network devices. Develop correlation rules that flag any deviation from baseline activity, and integrate all available threat intelligence feeds without specific vetting to ensure maximum visibility into potential threats. Option D. Prioritize log collection from critical infrastructure and systems directly involved in PHI storage and transmission. Develop correlation rules specifically designed to detect known attack patterns and policy violations, and integrate threat intelligence feeds that are vetted for relevance to healthcare-specific threats and privacy implications. The correct answer is A. Implement comprehensive log collection from all systems that interact with PHI. Develop sophisticated correlation rules to identify any anomalous activity, and integrate a wide range of threat intelligence feeds to proactively identify potential threats, with a focus on broad threat detection. Explanation: this scenario is professionally challenging because it requires balancing the technical capabilities of log collection and event correlation with the specific privacy mandates of HIPAA. The healthcare organization must ensure that its security monitoring practices do not inadvertently violate patient privacy rights or create unnecessary risks of unauthorized access to protected health information. 5. The integration of threat intelligence adds another layer of complexity, as it necessitates careful consideration of how external threat data is used and whether it could lead to discriminatory profiling or overcollection of sensitive information. The correct approach involves establishing a robust security monitoring program that prioritizes the collection of security-relevant logs, implements correlation rules focused on identifying potential security incidents, and integrates threat intelligence in a manner that is strictly limited to identifying and mitigating threats to the organization's systems and PHI. This approach aligns with HIPAA security rule, which mandates the implementation of security measures to protect the confidentiality, integrity, and availability of electronic PHI. Specifically, the requirement for access control, audit controls, and integrity controls necessitates effective log collection and monitoring to detect and respond to unauthorized access or modifications. Furthermore, the HIPAA breach notification rule requires timely notification of breaches, which is facilitated by prompt incident alerting derived from effective monitoring. Integrating threat intelligence in a privacy-preserving manner ensures that the organization can proactively defend against threats without compromising the privacy of individuals whose data it holds. An incorrect approach that focuses solely on collecting all available logs without a clear security objective risks overcollection of PHI, increasing the potential for privacy violations and making it harder to identify genuine security threats amidst noise. This violates the principle of minimum necessary access and use of PHI as stipulated by HIPAA. Another incorrect approach that prioritizes broad threat intelligence integration without considering its impact on PHI could lead to the inappropriate use or disclosure of sensitive information, potentially violating HIPAA privacy rule. For instance, using threat intelligence to broadly flag individuals based on their online activities, rather than focusing on malicious IP addresses or known attack vectors, would be a significant ethical and regulatory failure. A third incorrect approach that delays incident alerting or correlation of events due to resource constraints or a lack of defined processes would directly contraindicate HIPAA requirements for timely detection and response to security incidents, increasing the likelihood of a reportable breach and associated penalties. Professionals should adopt a risk-based approach, starting with a thorough understanding of the types of PHI handled and the potential threats to that data. This understanding should inform the design of the log collection strategy, the development of correlation rules, and the selection and integration of threat intelligence. Regular review and refinement of these processes, in consultation with privacy officers and legal counsel, are essential to ensure ongoing compliance with HIPAA and to maintain an effective security posture. Question 8. Compliance review shows that a large healthcare system has recently experienced a significant ransomware attack, encrypting critical patient data and disrupting electronic health record (EHR) access for several days. The IT security team has successfully isolated the affected systems and is working on restoring data from backups. The Chief Information Security Officer, CISO, is now determining the immediate next steps. Which of the following represents the most appropriate course of action? Option A. Activate the organization's predefined incident response plan, which includes immediate containment, thorough investigation of the breach's scope and impact, engagement of legal counsel and forensic experts, and prompt notification to affected individuals and relevant regulatory bodies as required by law, while simultaneously working on system and data restoration. Option B. Immediately focus on restoring all affected systems and data from the most recent available backups to minimize operational downtime, and then address regulatory reporting and patient notification once operations are fully restored. Option C. Prioritize public relations efforts to manage the organization's reputation and inform the public about the incident, while temporarily suspending all patient care operations until the IT department can guarantee complete system security. Option D. Initiate a full system rebuild from scratch, assuming all existing backups are compromised, and delay any external communication or regulatory reporting until the new infrastructure is fully operational and secured. The correct answer is B. Immediately focus on restoring all affected systems and data from the most recent available backups to minimize operational downtime, and then address regulatory reporting and patient notification once operations are fully restored. Explanation. This scenario is professionally challenging because ransomware attacks on healthcare organizations represent a significant threat to patient safety, data integrity, and operational continuity. The sensitive nature of protected health information, PHI, necessitates strict adherence to privacy regulations, while the critical need for uninterrupted patient care demands robust security and recovery measures. The complexity arises from balancing immediate response needs with long-term compliance obligations and the financial implications of both the attack and the preventative/recovery investments. Careful judgment is required to prioritize actions that mitigate immediate harm, ensure regulatory compliance, and build resilience against future threats. The correct approach involves a multifaceted strategy that prioritizes patient safety and data integrity, followed by a structured incident response aligned with regulatory requirements. This includes immediate containment of the threat, thorough investigation to understand the scope and impact, and prompt notification to affected individuals and regulatory bodies as mandated by law. Crucially, it involves activating a predefined business continuity and disaster recovery plan that has been tested and validated. This plan should outline procedures for restoring systems and data from secure backups, ensuring minimal disruption to patient care and compliance with breach notification timelines. The ethical imperative to protect patient privacy and the legal obligation to report breaches under regulations like HIPAA, Health Insurance Portability and Accountability Act, are paramount. An incorrect approach would be to solely focus on restoring systems without a comprehensive incident response plan that addresses regulatory notification requirements. This failure to promptly notify affected individuals and regulatory authorities within the legally prescribed timeframes constitutes a significant violation of HIPAA breach notification rule. Another incorrect approach is to prioritize financial recovery or public relations over patient safety and data integrity. This could lead to decisions that compromise the thoroughness of the investigation or the security of restored systems, potentially exacerbating the breach and increasing liability. Furthermore, neglecting to involve legal counsel and forensic experts early in the response process can lead to missteps in evidence preservation and regulatory compliance. Professionals should employ a decision-making framework that begins with a rapid assessment of the incident's impact on patient safety and critical operations. This should be followed by activating the incident response plan, which should include clear roles and responsibilities for containment, eradication, and recovery. Simultaneously, legal and compliance teams must be engaged to ensure adherence to all applicable regulations, including breach notification requirements. A proactive approach to cybersecurity, including regular risk assessments, employee training, robust backup strategies, and incident response plan testing, is essential for preventing and mitigating the impact of ransomware attacks. Question 9. Quality control measures reveal that a significant portion of the primary data center housing critical patient health records and operational systems has been rendered inaccessible due to an unforeseen regional infrastructure failure. The organization's emergency response team is activated. Which of the following actions best aligns with the Certified in Healthcare Privacy and Security (CHPS) principles and U.S. regulatory frameworks for ensuring continuity of care and safeguarding protected health information during such a disaster? Option A. Temporarily suspend all access to and processing of PHI until the primary data center is fully restored, prioritizing the physical security of the unaffected backup tapes stored offsite. Option B. Immediately initiate the predefined disaster recovery and business continuity plan, focusing on activating alternate data processing capabilities and secure remote access protocols for essential personnel to maintain patient care and access PHI as outlined in the plan. Option C. Begin rebuilding the primary data center from scratch using the most readily available hardware, bypassing established security configurations to expedite system restoration. Option D. Authorize all clinical staff to use personal devices and unsecured communication channels to access and share patient information to ensure immediate patient care continuity. The correct answer is B. Immediately initiate the predefined disaster recovery and business continuity plan, focusing on activating alternate data processing capabilities and secure remote access protocols for essential personnel to maintain patient care and access PHI as outlined in the plan. Explanation. Scenario analysis. This scenario is professionally challenging because it requires balancing immediate operational needs with long-term patient safety and regulatory compliance during a disruptive event. The healthcare organization must ensure the continuity of critical patient care services while adhering to stringent privacy and security mandates, particularly concerning protected health information. 5. The pressure to restore services quickly can lead to shortcuts that compromise these obligations. Correct approach analysis. The correct approach involves activating the established disaster recovery and business continuity plan, which is designed to address such exigencies. This plan should outline procedures for maintaining critical functions, including patient care and PHI protection, during and after a disaster. Specifically, it should detail how to securely access and manage PHI from alternate locations or systems, ensuring that all actions taken remain compliant with HIPAA privacy and security rules. This includes maintaining audit trails, ensuring data integrity, and providing necessary training to staff operating under emergency conditions. The plan's existence and adherence to it demonstrate due diligence and a commitment to patient safety and privacy. Incorrect approaches analysis, an approach that prioritizes restoring all systems immediately without a phased, risk-assessed approach, especially if it bypasses established security protocols for accessing PHI, is professionally unacceptable. This could lead to unauthorized access or breaches of PHI, violating the HIPAA security rules requirements for safeguarding electronic PHI, E5, and the privacy rules stipulations on the use and disclosure of PHI. Another incorrect approach would be to halt all operations involving PHI until full system restoration, even if critical patient care is jeopardized. While patient safety is paramount, a well-designed business continuity plan should provide mechanisms for continuing essential services, including access to necessary patient information, in a secure manner. Failure to do so could be considered a violation of the HIPAA requirement to maintain patient care and could also lead to adverse patient outcomes, which is an ethical failure. Finally, an approach that relies on ad hoc, undocumented methods for accessing or transmitting PHI during the emergency, even with good intentions, is also professionally unacceptable. This lack of documentation hinders accountability, makes it impossible to conduct a thorough post-incident review, and creates significant compliance risks under HIPAA, as it fails to demonstrate the organization's commitment to safeguarding PHI throughout the incident. Professional reasoning. Professionals should always refer to their organization's documented disaster recovery and business continuity plans. These plans are developed based on risk assessments and regulatory requirements, including HIPAA. During a disaster, the decision-making process should be guided by the plan's provisions for maintaining critical functions, ensuring patient safety, and protecting PHI. If the plan is insufficient or unclear, immediate consultation with privacy and security officers, legal counsel, and IT leadership is essential to make informed decisions that align with regulatory obligations and ethical responsibilities. Question 10. Process analysis reveals that a healthcare organization is struggling to implement a comprehensive data security strategy for its electronic protected health information, E5. The organization has identified the need for encryption, but is debating the most effective and compliant approach. Which of the following strategies best addresses the organization's obligations under the Health Insurance Portability and Accountability Act, HIPAA, security rule for protecting ePHI? Option A. Implement encryption for data at rest without a formal key management plan, relying on default system settings for key protection. Option B. Implement strong encryption for data at rest and in transit, supported by a robust key management system and granular access controls. Option C. Deploy encryption solely for data in transit, assuming that data at rest is adequately protected by network firewalls. Option D. Utilize a single, universally applied encryption algorithm for all ePHI, prioritizing ease of implementation over specific data sensitivity. The correct answer is B. Implement strong encryption for data at rest and in transit, supported by a robust key management system and granular access controls. Explanation. This scenario presents a common implementation challenge in healthcare data security, balancing the need for robust encryption with the operational realities of accessing and processing sensitive patient data. The challenge lies in selecting an encryption strategy that not only meets regulatory requirements for protecting protected health information, but also ensures that authorized users can efficiently perform their duties without undue burden or compromise to patient care. Careful judgment is required to avoid overimplementation that hinders workflow or underimplementation that leaves data vulnerable. The correct approach involves implementing robust encryption for data at rest and in transit, coupled with a well-defined key management system and access controls. This strategy directly aligns with the Health Insurance Portability and Accountability Act, HIPAA security rule, which mandates the use of technical safeguards to protect the confidentiality, integrity, and availability of electronic PHI E5. Specifically, encryption is considered a strong safeguard under HIPAA, particularly for data at rest, as it renders ePHI unintelligible to unauthorized individuals. Comprehensive key management system ensures that encryption keys are securely generated, stored, distributed, and revoked, which is critical for maintaining the effectiveness of encryption. Granular access controls ensure that only authorized personnel can decrypt and access the data they need, further reinforcing HIPAA requirements for access control and audit controls. Implementing encryption without a robust key management system is an incorrect approach. While encryption itself is a technical safeguard, its effectiveness is entirely dependent on the security of the encryption keys. If keys are poorly managed, they can be compromised, rendering the encryption useless and exposing PHI. This failure to adequately secure the keys would violate the spirit and intent of the HIPAA security rule, which requires a comprehensive approach to safeguarding ePHI. Choosing to encrypt only data in transit, while a necessary component of data security, is an incomplete and therefore incorrect approach for protecting data at rest. The HIPAA security rule requires safeguards for both, leaving sensitive patient data unencrypted on servers, workstations, or portable devices creates significant vulnerabilities to unauthorized access or disclosure, a direct contravention of HIPAA requirements for protecting ePHI. Opting for a single, universally applied encryption algorithm without considering performance implications or the specific sensitivity of different data types is also an incorrect approach. While standardization can be beneficial, a one-size-fits-all solution may not be optimal. Certain data types might require stronger encryption, or conversely, less computationally intensive encryption might be acceptable for less sensitive information, impacting system performance and user experience. This could indirectly lead to workarounds that bypass security controls, thereby compromising data protection and potentially violating HIPAA requirements for risk analysis and management. Professionals should approach such decisions by first conducting a thorough risk analysis as mandated by HIPAA. This involves identifying potential threats and vulnerabilities to ePHI, assessing their likelihood and impact, and then selecting appropriate technical, physical, and administrative safeguards. The chosen encryption technology and its implementation must be evaluated against these risks, ensuring compliance with HIPAA-specific requirements for encryption, access control, and audit controls, while also considering operational efficiency and the impact on patient care. Question 11. Consider a scenario where a healthcare organization learns about upcoming significant changes to federal regulations impacting the privacy and security of electronic protected health information, E5. What is the most effective process optimization strategy for the organization to ensure timely and compliant adaptation? Option A. Initiate a comprehensive review of the new federal regulations, assess their impact on existing policies, procedures, and technologies, and develop a phased implementation plan. Option B. Wait for a data breach to occur to trigger a review of the new regulations and implement necessary changes. Option C. Focus solely on updating technical security controls to meet perceived new requirements without reviewing privacy policies or operational procedures. Option D. Implement changes based on informal discussions with industry peers and general guidance from trade publications. The correct answer is A. Initiate a comprehensive review of the new federal regulations, assess their impact on existing policies, procedures, and technologies, and develop a phased implementation plan. Explanation. This scenario presents a common challenge in healthcare privacy and security, adapting to evolving federal regulations. The professional challenge lies in accurately interpreting and implementing new requirements while ensuring ongoing compliance and operational efficiency. It demands a proactive and systematic approach to regulatory change management. The correct approach involves a comprehensive review of the new federal regulations, identifying specific impacts on existing policies, procedures, and technologies, and then developing a phased implementation plan. This is crucial because federal healthcare privacy and security laws, such as HIPAA, are designed to protect sensitive patient information. Changes to these regulations often introduce new mandates for data protection, breach notification, or patient rights. A thorough review ensures that all aspects of the organization's operations are brought into alignment with the updated legal framework, thereby mitigating the risk of noncompliance, which can lead to significant penalties, reputational damage, and loss of patient trust. An incorrect approach of delaying the review until a breach occurs is a critical failure. This reactive stance directly violates the proactive principles embedded in healthcare privacy and security regulations. It demonstrates a lack of due diligence and a failure to anticipate and mitigate risks, which can result in severe legal repercussions and a breakdown in patient confidence. Another incorrect approach of implementing changes based solely on industry rumors or informal guidance is also professionally unacceptable. Healthcare privacy and security are governed by specific legal mandates. Relying on unverified information can lead to misinterpretation of requirements, incomplete implementation, or the adoption of unnecessary or ineffective controls, all of which expose the organization to compliance risks. Finally, an approach that focuses only on technical security measures without considering the privacy implications or policy updates is insufficient. Federal regulations often address both privacy and security, and a holistic approach is necessary. Neglecting policy or privacy considerations can lead to noncompliance even if technical safeguards are in place, as the regulations often require documented policies and procedures that reflect current legal obligations. Professionals should adopt a systematic process for managing regulatory changes. This includes establishing a dedicated team or assigning responsibility for monitoring regulatory updates, conducting thorough impact assessments, developing clear implementation plans with timelines and assigned responsibilities, providing adequate training to staff, and regularly auditing compliance to ensure ongoing adherence to the updated federal framework. Question 12. The efficiency study reveals that implementing a new, fully integrated electronic health record (EHR) system promises significant improvements in patient care coordination and administrative workflow. However, the organization is concerned about potential HIPAA violations, especially given the recent increase in penalties for such infractions and the expanded breach notification requirements. The organization also relies on several third-party vendors for various IT services that will interact with the EHR. Which of the following strategies best balances the benefits of EHR adoption with HIPAA compliance? Option A. Rely on the EHR vendor's standard security protocols and BAAs, assuming they are compliant with all HIPAA requirements without independent verification or specific contractual addendums. Option B. Proceed with EHR implementation immediately to realize efficiency gains, assuming existing general IT security measures will adequately protect electronic protected health information, E5. Option C. Focus solely on training staff on EHR usage and workflow, deferring detailed security assessments and BAA reviews until after the system is fully operational. Option D. Conduct a thorough HIPAA security rule risk analysis specifically for the EHR system. Implement necessary technical, physical, and administrative safeguards. Update all business associate agreements (BA) to reflect the scope of EHR data and potential breach scenarios, and establish a robust incident response plan for breach notification. The correct answer is D. Conduct a thorough HIPAA security rule risk analysis specifically for the EHR system. Implement necessary technical, physical, and administrative safeguards. Update all business associate agreements (BA) to reflect the scope of EHR data and potential breach scenarios, and establish a robust incident response plan for breach notification. Explanation. This scenario is professionally challenging because it requires balancing the promotion of electronic health records (EHR) with the stringent privacy and security obligations mandated by HIPAA, particularly in light of increased penalties for violations and expanded breach notification requirements. The organization must navigate the complexities of business associate agreements and ensure that the efficiency gains from EHR adoption do not inadvertently lead to noncompliance. Careful judgment is required to implement EHRs in a manner that is both effective and legally sound, safeguarding protected health information. 5. The correct approach involves a comprehensive risk assessment and the implementation of robust security safeguards specifically tailored to the EHR environment, alongside clear contractual obligations with business associates. This aligns with HIPAA security rule, which mandates administrative, physical, and technical safeguards to protect electronic PHI. Furthermore, it addresses the heightened penalties for violations by proactively mitigating risks. The breach notification requirements under HIPAA are also directly addressed by ensuring that the organization has processes in place to identify and report breaches promptly. Business associate liability is managed through meticulously drafted business associate agreements, BA, that clearly define responsibilities and liabilities, ensuring that third-party vendors adhere to HIPAA standards. An incorrect approach that focuses solely on the efficiency benefits of EHRs without a commensurate investment in privacy and security safeguards would be professionally unacceptable. This failure to prioritize HIPAA compliance could lead to significant penalties, reputational damage, and erosion of patient trust. Another incorrect approach that neglects to update BAAs to reflect the expanded scope of EHR data and potential breach scenarios would expose the organization to undue risk and potential liability for the actions of its business associates. This overlooks the direct liability business associates can face under HIPAA and the organization's responsibility to ensure their compliance. A third incorrect approach that assumes existing security measures are sufficient for EHRs without a specific risk analysis for the new technology would be a critical oversight. EHRs introduce new vulnerabilities and data flows that require dedicated security considerations beyond general IT security. Professionals should employ a decision-making framework that begins with understanding the regulatory landscape, specifically HIPAA requirements regarding EHRs, breach notification, and business associate obligations. This should be followed by a thorough risk assessment to identify potential vulnerabilities associated with EHR implementation. Based on the risk assessment, appropriate administrative, physical, and technical safeguards must be designed and implemented. Contractual agreements, particularly BAAs, must be reviewed and updated to reflect the specific risks and responsibilities related to EHR data. Continuous monitoring and auditing are essential to ensure ongoing compliance and adapt to evolving threats and regulatory interpretations. Question 13. Stakeholder feedback indicates that the current data protection measures are insufficient to prevent potential breaches of protected health information. 5. The organization needs to implement a more robust strategy for identifying, classifying, and controlling sensitive data across its network and endpoints. Which of the following approaches best aligns with best practices for network and endpoint data loss prevention, DLP, and data discovery within the U.S. healthcare regulatory framework? Option A. Implement a comprehensive data discovery and classification initiative to identify all PHI, followed by the deployment of integrated network and endpoint DLP solutions with policies tailored to the classified data. Option B. Deploy network DLP solutions across all network segments to monitor and block any data transfers deemed suspicious, without prior data discovery or classification. Option C. Rely on manual data classification processes and periodic security audits to identify and address potential data loss incidents. Option D. Focus exclusively on deploying endpoint DLP agents on all user devices to prevent data exfiltration, without addressing network-level data flows or data at rest. The correct answer is A. Implement a comprehensive data discovery and classification initiative to identify all PHI, followed by the deployment of integrated network and endpoint DLP solutions with policies tailored to the classified data. Explanation. This scenario is professionally challenging because it requires balancing robust data protection with operational efficiency and user experience, all while adhering to stringent U.S. healthcare privacy regulations, primarily HIPAA. The challenge lies in implementing effective data loss prevention, DLP strategies that accurately identify, classify, and protect sensitive health information, without unduly hindering legitimate clinical workflows or introducing excessive false positives. The need for a comprehensive approach that spans network, endpoint, and data discovery is critical for a multi-layered defense. The correct approach involves a phased, integrated strategy that begins with thorough data discovery and classification, followed by the implementation of network and endpoint DLP policies informed by this understanding. This approach is correct because it directly addresses the core requirements of HIPAA security rule, which mandates administrative, physical, and technical safeguards to protect the confidentiality, integrity, and availability of electronic PHI. Data discovery and classification are foundational to identifying what needs protection, enabling targeted policy enforcement. Network DLP and endpoint DLP then act as technical safeguards to prevent unauthorized access, use, or disclosure of ePHI, aligning with the HIPAA requirement for access controls and audit controls. This integrated methodology ensures that DLP efforts are precise, efficient, and compliant. An incorrect approach that focuses solely on deploying network DLP without prior data discovery and classification is professionally unacceptable. This failure stems from a lack of understanding of what constitutes PHI, leading to potentially overbroad or ineffective policies. It risks either missing critical breaches of PHI or creating significant operational disruptions due to excessive blocking of legitimate data transfers, thereby failing to meet the minimum necessary standard and potentially impacting patient care. Another incorrect approach that prioritizes endpoint DLP as the sole solution, neglecting network-level controls and data discovery, is also professionally flawed. While endpoint DLP is vital for protecting data on devices, it leaves significant gaps in protecting data in transit or at rest on servers and in cloud environments. This fragmented approach fails to provide a comprehensive security posture required by HIPAA, leaving ePHI vulnerable to various attack vectors and insider threats. A third incorrect approach that relies on manual data classification and ad hoc policy enforcement is highly inefficient and prone to human error. This method is unlikely to scale with the volume of data in a healthcare organization and cannot provide the real-time monitoring and enforcement necessary to comply with HIPAA requirements for timely breach notification and ongoing risk management. It fails to establish a systematic and auditable process for data protection. The professional decision-making process for similar situations should involve a risk-based assessment, starting with understanding the organization's data landscape through discovery and classification. This understanding then informs the selection and configuration of appropriate technical safeguards, such as network and endpoint DLP, to enforce policies that align with regulatory requirements and business needs. Continuous monitoring, regular policy review, and user training are essential components of an effective and compliant data protection program. Question 14. Compliance review shows that a mid-sized healthcare provider is seeking to enhance its cybersecurity posture across the identify, protect, detect, respond, and recover functions. The organization has a basic understanding of its assets and threats, but lacks formal, documented processes for many security activities. Considering the organization's current maturity and the need for a risk-informed approach aligned with U.S. healthcare regulation, which implementation strategy for the NIST cybersecurity framework would be most appropriate? Option A. Select a Tier 3, repeatable implementation for the protect and detect functions, and a Tier 2, risk-informed implementation for identify, respond, and recover. Option B. Implement controls consistent with a Tier 2, risk-informed implementation across all 5 core functions, focusing on documented processes and risk-based decision-making. Option C. Adopt a Tier 1, partial implementation for all functions, prioritizing only the most critical and legally mandated safeguards. Option D. Mandate a Tier 4, adaptive implementation for all functions to ensure the highest level of security, regardless of specific risk levels. Correct answer is B. Implement controls consistent with a Tier 2, risk-informed implementation across all 5 core functions, focusing on documented processes and risk-based decision-making. Explanation. This scenario presents a common challenge in healthcare privacy and security, balancing the implementation of robust cybersecurity functions with the practical constraints of resource allocation and organizational maturity. The Certified in Healthcare Privacy and Security, CHPS, professional must demonstrate an understanding of how the NIST cybersecurity framework's core functions, identify, protect, detect, respond, recover, are applied across different implementation tiers and profiles, ensuring that the chosen approach aligns with regulatory requirements and organizational risk tolerance. The challenge lies in selecting an approach that is both compliant and effective, avoiding over- or under-implementation of controls. The correct approach involves aligning the organization's cybersecurity posture with its specific risk profile and operational needs, as guided by the NIST cybersecurity framework's implementation tiers and profiles. This means understanding that a Tier 2, risk-informed implementation might be appropriate for an organization with some awareness of cybersecurity risks, but lacking formal processes, while a Tier 4, Adaptive implementation would be suitable for a highly mature organization with advanced capabilities. The CHPS professional must advocate for an implementation that reflects the organization's current state and strategic goals, ensuring that controls within each function are proportionate to the identified risks. This aligns with the HIPAA security rules mandate for risk analysis and risk management, requiring covered entities to implement security measures sufficient to reduce risks and vulnerabilities to a reasonable and appropriate level. Ethical considerations also demand that patient data is protected to the highest feasible standard given the organization's circumstances. An incorrect approach would be to adopt a one-size-fits-all strategy, such as mandating a Tier 4 adaptive implementation across the entire organization without a thorough risk assessment. This could lead to unnecessary expenditure and complexity for areas with lower risk profiles, failing to meet the reasonable and appropriate standard of HIPAA. Conversely, adopting a Tier 1 partial implementation for all functions, even in high-risk areas, would be a significant regulatory failure. This demonstrates a lack of understanding of the varying levels of rigor required for different risk environments and neglects the proactive and adaptive measures necessary to protect sensitive health information effectively. Such an approach would likely result in inadequate safeguards, increasing the likelihood of breaches and non-compliance with HIPAA administrative, physical, and technical safeguard requirements. Professional decision-making in such situations requires a systematic process. First, conduct a comprehensive risk assessment to understand the organization's threat landscape and vulnerabilities. Second, map these risks to the NIST cybersecurity framework functions and identify the appropriate implementation tier and profile based on the organization's risk tolerance and resources. Third, develop a phased implementation plan that prioritizes controls in high-risk areas and gradually matures the cybersecurity posture across all functions. Finally, continuously monitor, evaluate, and adapt the cybersecurity program to address evolving threats and regulatory changes, ensuring ongoing compliance and effective risk management. Question 15. Cost-benefit analysis shows that implementing a comprehensive, proactive patching and monitoring program for all connected medical devices, including those deemed less critical for direct patient care, but which handle electronic protected health information, EFI, incurs significant upfront investment in technology and personnel. However, the potential costs associated with a data breach stemming from an unpatched medical device, including regulatory fines, reputational damage, and remediation expenses, are substantially higher. Given these considerations and the requirements of the HIPAA security rule, which of the following represents the most appropriate strategic approach for managing security vulnerabilities in medical devices? Option A. Implement a systematic process for inventorying all connected medical devices, conducting regular risk assessments to identify vulnerabilities, and establishing a prioritized patching and continuous monitoring program for all devices handling EPHI, aligned with HIPAA security rule mandates. Option B. Focus security efforts on network perimeter defenses, assuming that internal medical devices are sufficiently isolated and protected from external threats. Option C. Prioritize patching and monitoring efforts exclusively on critical life support medical devices, deferring updates for other devices to reduce immediate operational costs and complexity. Option D. Rely solely on medical device manufacturers to notify and provide patches, without establishing an internal process for verifying, testing, and deploying these updates in a timely manner. The correct answer is C. Prioritize patching and monitoring efforts exclusively on critical life support medical devices, deferring updates for other devices to reduce immediate operational costs and complexity. Explanation: this scenario is professionally challenging because it requires balancing the immediate operational needs of a healthcare facility with the long-term security and privacy obligations mandated by U.S. healthcare regulations, specifically the Health Insurance Portability and Accountability Act, HIPAA security rule. The inherent vulnerability of medical devices to cyber threats, coupled with the critical nature of patient care, creates a high-stakes environment where security decisions have direct patient safety and privacy implications. The pressure to maintain service continuity can often conflict with the need for thorough security patching and monitoring, demanding a nuanced and risk-based approach. The correct approach involves a proactive and comprehensive strategy for managing medical device security vulnerabilities. This includes establishing a robust inventory of all connected medical devices, conducting regular risk assessments to identify potential vulnerabilities, and implementing a systematic patching and updating process that prioritizes devices based on their criticality and the severity of the vulnerability. Continuous monitoring of device activity for anomalous behavior and prompt incident response are also crucial components. This approach aligns directly with the HIPAA security rules requirements for risk analysis and risk management, 45 CFR Section 164, 308A.1, Roman 2, A and B, which mandate that covered entities identify and assess potential risks to the confidentiality, integrity, and availability of electronic protected health information, E5, and implement security measures sufficient to reduce those risks to a reasonable and appropriate level. It also supports the requirement for access control and audit controls, 45 CFR Section 164, 312A.1 and B, by ensuring that devices are properly secured and their activities are logged. An incorrect approach that prioritizes immediate cost savings by delaying or skipping patching for non-critical medical devices, even if they handle EPHI, fails to meet the HIPAA security rules mandate for comprehensive risk management. While a device might be deemed non-critical for direct patient care, if it stores, processes, or transmits EPHI, any vulnerability on that device represents a potential pathway for unauthorized access or compromise of that sensitive information. This approach creates an unacceptable risk to EPHI and violates the reasonable and appropriate standard for security measures. Another incorrect approach that relies solely on vendor-provided security updates without independent verification or a defined patching schedule overlooks the covered entity's ultimate responsibility for safeguarding EPHI. While vendor updates are important, the healthcare organization must have processes in place to test, approve, and deploy these updates in a timely manner, considering the operational impact and potential for disruption. A passive reliance on vendors can lead to significant delays in patching, leaving systems exposed to known threats and violating the spirit and letter of the HIPAA security rules requirements for risk management and timely implementation of security measures. A third incorrect approach that focuses only on patching critical life support devices while ignoring other connected medical devices that may also store or transmit EPHI is also professionally unacceptable. The HIPAA security rule applies to all systems and devices that handle EPHI, not just those directly involved in immediate life support. A vulnerability in a less critical device could still be exploited to gain access to the network and subsequently to more sensitive patient data, thereby compromising the confidentiality and integrity of EPHI. This selective application of security measures creates a fragmented and inadequate security posture. The professional decision-making process for such situations should involve a structured risk management framework. This begins with a thorough inventory and classification of all connected medical devices, assessing their function, the type of EPHI they handle, and their connectivity to the network. A comprehensive risk assessment should then be conducted for each device, identifying potential vulnerabilities and their likelihood of exploitation. Based on this assessment, a prioritized patching and remediation strategy should be developed, considering the criticality of the device, the severity of the vulnerability, and the potential impact on patient care and EPHI. Continuous monitoring and incident response capabilities are essential to detect and address any security breaches promptly. This systematic, risk-based, and compliance-driven approach ensures that security measures are both effective and proportionate to the identified risks, fulfilling the organization's legal and ethical obligations. Question 16. The monitoring system demonstrates the use of an artificial intelligence algorithm to detect potential unauthorized access to electronic protected health information, E5. The system flags a specific user's activity as a high-risk event, but the underlying logic and data points that led to this classification are not readily accessible or interpretable by the privacy and security team. What is the most appropriate course of action to ensure compliance with U.S. healthcare privacy regulations and ethical best practices? Option A. Deactivate the AI monitoring system for this specific user to avoid further alerts while the organization researches more transparent AI solutions, accepting the temporary increase in risk. Option B. Implement a process to investigate the flagged activity by reviewing the user's access logs and audit trails, and concurrently work with the AI vendor or internal development team to enhance the explainability of the AI model's decision-making for future events. Option C. Accept the AI system's alert as definitive and initiate breach notification procedures based solely on the AI's flagging, without further investigation or understanding of the AI's rationale. Option D. Immediately suspend the flagged user's access to ePHI pending a full investigation, without attempting to understand the AI's reasoning, to err on the side of caution. The correct answer is B. Implement a process to investigate the flagged activity by reviewing the user's access logs and audit trails, and concurrently work with the AI vendor or internal development team to enhance the explainability of the AI model's decision-making for future events. Explanation. The monitoring system demonstrates the use of artificial intelligence, AI, in healthcare decision-making, specifically in identifying potential patient privacy breaches. This scenario is professionally challenging because AI, while powerful, can operate as a black box, making it difficult to understand the rationale behind its conclusions. Ensuring transparency and explainability in these AI-driven decisions is paramount for regulatory compliance, ethical patient care, and building trust. Professionals must balance the efficiency gains of AI with the fundamental right of individuals to understand how their data is being used and how decisions affecting them are made. The correct approach involves implementing a robust AI governance framework that prioritizes explainability. This means actively seeking AI models that offer interpretable outputs or developing methods to audit and explain the decisions of more complex models. This aligns with the principles of accountability and fairness embedded in U.S. healthcare privacy regulations, such as the Health Insurance Portability and Accountability Act, HIPAA. Specifically, HIPAA privacy rule requires covered entities to provide individuals with access to their protected health information, FI, and to account for disclosures. If an AI system flags a potential breach, the ability to explain why it did so is crucial for internal investigations, regulatory reporting, and potentially for informing patients about the nature of the incident. Furthermore, ethical considerations demand that individuals are not subject to opaque algorithmic judgments that could impact their privacy without recourse or understanding. An incorrect approach would be to rely solely on the AI system's output without any mechanism for validation or explanation. This fails to meet the spirit and letter of regulations that require demonstrable due diligence in protecting PHI. For instance, if the AI flags a potential breach, and the organization cannot explain the specific data points or logic that led to this conclusion, it becomes difficult to investigate the incident thoroughly, implement corrective actions, or provide a satisfactory response to regulatory inquiries. This lack of transparency also undermines patient trust, as individuals may feel their privacy is being managed by an inscrutable system. Another incorrect approach is to dismiss AI-generated alerts without a systematic review process. While false positives can occur, a blanket disregard for AI-driven insights, especially those related to privacy, represents a failure in risk management. It could lead to missed actual breaches, exposing the organization to significant legal, financial, and reputational damage. This approach neglects the proactive security measures that AI can facilitate and ignores the regulatory expectation to actively monitor for and respond to potential privacy violations. A third incorrect approach is to prioritize the speed of AI decision-making over the accuracy and explainability of its findings. While efficiency is desirable, it cannot come at the cost of fundamental privacy protections. If the AI is making decisions that impact patient privacy, the process must be understandable and verifiable. An opaque, rapid decision-making process that cannot be explained or audited is inherently risky and likely to fall short of regulatory requirements for safeguarding PHI. The professional decision-making process for such situations should involve a multifaceted risk assessment. This includes evaluating the AI system's design for inherent explainability, establishing clear protocols for auditing AI decisions, defining thresholds for human review of AI-generated alerts, and ensuring that the organization has the technical and human resources to investigate and explain any identified privacy concerns. It requires a commitment to continuous monitoring, validation, and adaptation of AI systems to ensure they operate within legal and ethical boundaries, fostering both security and transparency. Question 17. The monitoring system demonstrates a significant increase in patient wait times in the emergency department. To optimize staffing and resource allocation, the healthcare organization plans to analyze historical patient flow data, including admission times, treatment durations, and discharge times. Which of the following approaches best balances the need for process optimization with the requirements of the Health Insurance Portability and Accountability Act, HIPAA privacy rule? Option A. Analyze the raw patient flow data, including all direct and indirect identifiers, to gain the most granular insights into bottlenecks. Option B. Proceed with the analysis of identifiable patient data, relying on the justification that this is for internal operational improvement and does not constitute a disclosure to a third party. Option C. Conduct the analysis using data that has been de-identified according to the HIPAA safe harbor method, removing all unique patient identifiers and other potentially re-identifiable information. Option D. Implement a simplified anonymization technique that removes only patient names and medical record numbers, assuming this is sufficient for internal process improvement analysis. Correct answer is A. Analyze the raw patient flow data, including all direct and indirect identifiers, to gain the most granular insights into bottlenecks. Explanation. This scenario is professionally challenging because it requires balancing the benefits of data analytics for process optimization with the stringent privacy obligations mandated by U.S. healthcare regulations, specifically the Health Insurance Portability and Accountability Act, HIPAA. The core tension lies in extracting actionable insights from protected health information, FI, without compromising patient privacy or violating the HIPAA privacy rule. Careful judgment is required to ensure that any data analysis activities are conducted in a manner that is both compliant and ethically sound, respecting the trust placed in healthcare organizations. The correct approach involves de-identifying the data to a standard that removes all identifiers, rendering it no longer PHI, before conducting the analysis. This aligns with the HIPAA privacy rules provisions for using de-identified data for research, public health activities, and healthcare operations without patient authorization. By removing direct and indirect identifiers according to the safe harbor method or expert determination, the organization can leverage the analytical power of the data for process improvement while mitigating privacy risks and avoiding potential breaches. This proactive de-identification ensures that the analysis itself does not involve the use or disclosure of PHI, thereby upholding the fundamental principles of patient privacy. An incorrect approach would be to analyze the data in its identifiable form, even with the intention of improving processes. This directly violates the HIPAA privacy rule, which restricts the use and disclosure of PHI to specific permitted purposes and generally requires patient authorization for other uses. Another incorrect approach would be to rely on a less rigorous form of anonymization that does not meet HIPAA de-identification standards. While it might seem like a step towards privacy, if the data can still be reasonably re-identified, it remains PHI, and its analysis without proper safeguards or authorization would be a violation. Finally, assuming that internal use for process optimization automatically permits the use of identifiable PHI without further consideration of the privacy rules requirements is a critical ethical and regulatory failure. Professionals should employ a decision-making framework that prioritizes regulatory compliance and ethical considerations. This involves first identifying the data involved and determining if it constitutes PHI under HIPAA. If it is PHI, the next step is to assess the intended use of the data. For process optimization, the most compliant and ethical path is to de-identify the data according to HIPAA standards. If de-identification is not feasible or appropriate for the specific analytical goal, then the organization must explore whether patient authorization is obtainable or if another permissible use under HIPAA applies. A risk assessment should be conducted at each stage to evaluate potential privacy impacts and ensure that safeguards are in place. Question 18. Market research demonstrates that healthcare organizations frequently face challenges in accessing patient information during emergent situations where a patient is incapacitated and requires immediate medical attention. A hospital's emergency department physician needs to quickly review a patient's medication history and known allergies to administer appropriate treatment. The patient is unconscious and no family members are immediately present. The physician has a secure electronic health record (EHR) system available, Which of the following approaches best balances the immediate need for patient care with privacy regulations under U.S. federal law? Option A. Delay treatment until a family member can be contacted to provide consent for accessing the patient's medical information, as direct patient consent cannot be obtained. Option B. Obtain a verbal OK from the nearest available hospital staff member, regardless of their role or relationship to the patient, to access the patient's medical information. Option C. Access all available patient information in the EHR, including past medical history, billing records, and social security number, to ensure a comprehensive understanding of the patient's background before administering treatment. Option D. Access only the specific medication history and allergy information from the EHR that is directly relevant to the immediate treatment decisions, and document the circumstances necessitating this access without patient consent. The correct answer is C. Access all available patient information in the EHR, including past medical history, billing records, and social security number, to ensure a comprehensive understanding of the patient's background before administering treatment. Explanation: this scenario presents a common ethical dilemma in healthcare privacy and security, particularly during emergencies. The challenge lies in balancing the immediate need for patient information to provide life-saving care against the fundamental right to privacy and the legal obligations to protect protected health information. 5. Professionals must navigate these competing demands with sound judgment, adhering strictly to established protocols and ethical principles. The correct approach prioritizes obtaining consent or documenting a good faith effort to obtain it, while also ensuring that any accessed information is limited to the minimum necessary for treatment. This aligns with the core principles of HIPAA, Health Insurance Portability and Accountability Act, in the United States, specifically the Privacy Rule, which allows for the use and disclosure of PHI without authorization in certain emergency situations to prevent or lessen a serious and imminent threat to health or safety. However, it also emphasizes the importance of documenting these disclosures and limiting them to what is absolutely necessary. The ethical imperative to provide care is balanced with the legal and ethical duty to protect patient privacy. An approach that bypasses all consent procedures and accesses all available patient information, even if not immediately critical for treatment, is ethically and legally flawed. This violates the principle of minimum necessary disclosure and could lead to unauthorized access and potential misuse of PHI, contravening HIPAA requirements. Another incorrect approach involves delaying necessary treatment due to an inability to obtain consent, even when the patient is incapacitated and the situation is life-threatening. While consent is generally required, HIPAA provides exceptions for emergency situations where obtaining consent is impracticable. Delaying care in such circumstances would be a failure of professional duty and an ethical breach, as the primary obligation is to preserve life and health. Finally, an approach that relies solely on a verbal OK from a family member without documenting the circumstances or the scope of information accessed is insufficient. While family consent can be valid in certain emergency contexts, the lack of proper documentation leaves the organization vulnerable to scrutiny and does not demonstrate adherence to the minimum necessary standard. It also fails to establish a clear record of why and how PHI was accessed, which is crucial for accountability and compliance. Professionals should employ a decision-making framework that first assesses the severity of the emergency and the patient's capacity to consent. If the patient is incapacitated and the situation is life-threatening, they should proceed with accessing the minimum necessary PHI for treatment, documenting the circumstances and the information accessed. If a surrogate decision-maker is available, their consent should be sought and documented. If there is doubt or ambiguity, consulting with legal counsel or a privacy officer, if feasible without compromising patient care, is advisable. The overarching principle is to act in the patient's best interest while adhering to regulatory requirements and ethical standards. Question 19. The evaluation methodology shows a healthcare organization considering migrating its electronic health records (EHR) system to a cloud-based solution. Which of the following risk assessment approaches best aligns with U.S. healthcare privacy and security regulations, specifically HIPAA, for ensuring the security of protected health information, FI, in this cloud environment? Option A. Relying solely on the cloud service provider's HITRUST certification as sufficient evidence of compliance with HIPAA security requirements. Option B. prioritizing the selection of the cloud provider offering the lowest cost, assuming that cost-effectiveness equates to adequate security. Option C, assuming that all security measures implemented by the cloud service provider are automatically compliant with HIPAA without further independent verification or assessment of the organization's responsibilities. Option D, conducting a comprehensive risk assessment that identifies and evaluates threats to PHI within the cloud environment, considering the cloud service provider's security controls and the organization's own responsibilities. Correct answer is D, conducting a comprehensive risk assessment that identifies and evaluates threats to PHI within the cloud environment, considering the cloud service provider's security controls and the organization's own responsibilities. Explanation: this scenario is professionally challenging because it requires balancing the benefits of cloud adoption with the stringent privacy and security obligations mandated by U.S. healthcare regulations, specifically HIPAA. The complexity arises from the shared responsibility model inherent in cloud computing, where the healthcare organization retains ultimate accountability for protected health information. 5. Even when it resides on a third-party provider's infrastructure. Careful judgment is required to ensure that the chosen cloud security approach adequately mitigates risks without hindering necessary business operations or violating regulatory mandates. The correct approach involves a comprehensive risk assessment that specifically identifies and evaluates threats to PHI within the cloud environment, considering the cloud service provider's security controls and the organization's own responsibilities. This aligns directly with HIPAA security rule requirements, 45 CFR Section 164, 308A1, Roman 2, which mandates a risk analysis to identify potential risks and vulnerabilities to the confidentiality, integrity, and availability of electronic PHI. It also supports the requirement for a risk management strategy, 45 CFR Section 164, 308A1, Roman 2, B, to address identified risks. This approach ensures that security measures are proportionate to the identified risks and that the organization can demonstrate due diligence in protecting PHI. An incorrect approach that focuses solely on the cloud service provider's certifications without independent verification fails to meet HIPAA requirements for due diligence. While certifications like HITRUST or SOC2 are valuable indicators, they do not absolve the covered entity of its responsibility to assess the specific risks to its PHI within that cloud environment. Relying solely on these certifications represents a regulatory failure to conduct a thorough risk analysis and implement appropriate safeguards tailored to the organization's specific data and operational context. Another incorrect approach that prioritizes cost savings over a detailed security review overlooks the fundamental obligation to protect PHI. HIPAA mandates that security measures be reasonable and appropriate, not necessarily the cheapest. A decision driven primarily by cost without a commensurate security evaluation risks significant regulatory penalties and reputational damage if a breach occurs due to inadequate protections. This constitutes a failure to implement a risk management strategy that prioritizes the security of PHI. A third incorrect approach that assumes all cloud provider security measures are automatically compliant with HIPAA ignores the nuances of the shared responsibility model. Covered entities must understand which security controls are managed by the provider and which remain their responsibility. A failure to delineate these responsibilities and ensure that the organization's own security practices are adequate for the PHI it manages in the cloud is a direct violation of HIPAA requirements for administrative, physical, and technical safeguards. A professional decision-making process for similar situations should involve a structured risk management framework. This begins with understanding the data being processed and stored in the cloud, identifying potential threats and vulnerabilities specific to that data and the cloud environment, evaluating the likelihood and impact of those risks, and then selecting and implementing appropriate security controls. This process must be documented, regularly reviewed, and updated to reflect changes in the threat landscape, technology, and regulatory requirements. Engaging legal and compliance counsel throughout this process is also crucial. Question 20. Strategic planning requires a covered entity to implement technical safeguards for the protection of electronic protected health information, EFI. Considering the requirements for data at rest and data in transit encryption, and the critical role of key management, Which of the following approaches best aligns with the HIPAA security rule and industry best practices for safeguarding ePHI? Option A. Encrypt ePHI in transit using TLS1. 2. But only encrypt ePHI at rest on portable media, assuming internal servers are adequately protected by firewalls. Option B. Utilize a proprietary encryption algorithm that has been internally vetted for security and implement a basic key storage mechanism on the same server as the encrypted data. Option C. Encrypt ePHI at rest using AES 256, but transmit ePHI unencrypted over internal networks to improve performance, relying solely on network access controls for protection during transit. Option D. Implement AES 256 encryption for ePHI at rest and in transit, supported by a robust key management system that includes secure key generation, storage, rotation, and access controls, with regular audits of key management processes. The correct answer is D. Implement AES 256 encryption for ePHI at rest and in transit, supported by a robust key management system that includes secure key generation, storage, rotation, and access controls, with regular audits of key management processes. Explanation: this scenario is professionally challenging because it requires balancing robust data security measures with operational efficiency and compliance with the Health Insurance Portability and Accountability Act, HIPAA security rule. The organization must implement encryption for protected health information, PHI, both at rest and in transit, while also ensuring that the chosen encryption algorithms and key management practices are secure, compliant, and manageable. The complexity lies in selecting appropriate, industry-standard encryption methods and establishing a secure, auditable process for key lifecycle management, all within the constraints of a healthcare environment. The correct approach involves implementing strong, industry-standard encryption algorithms like AES for data at rest and in transit, coupled with a robust key management system that adheres to HIPAA requirements for access control, rotation, and secure storage. This aligns with the HIPAA security rules mandate to protect the confidentiality, integrity, and availability of electronic PHI, EPHI. Specifically, the rule requires covered entities to implement technical safeguards, including encryption, to prevent unauthorized access or disclosure of ePHI. A well-defined key management strategy ensures that encryption keys are protected, managed throughout their lifecycle, and accessible only to authorized personnel, thereby maintaining the integrity of the encryption and the security of the data. An incorrect approach would be to implement encryption without a comprehensive key management strategy. This fails to address the critical aspect of protecting the encryption keys themselves, which are the foundation of the encryption security. If keys are not managed securely, they can be compromised, rendering the encryption useless and exposing ePHI to unauthorized access. This directly violates the HIPAA security rules intent to safeguard ePHI. Another incorrect approach would be to select outdated or proprietary encryption algorithms. While they might offer some level of protection, they may not meet current industry standards for strength and resilience against evolving threats. Furthermore, reliance on non-standard algorithms can lead to interoperability issues and make it difficult to ensure compliance with evolving regulatory expectations. The HIPAA security rule implicitly encourages the use of recognized security standards. A third incorrect approach would be to encrypt data at rest but not data in transit, or vice versa, without a risk assessment justifying the omission. The HIPAA security rule requires covered entities to implement appropriate technical safeguards for both scenarios. Failing to encrypt data in transit, for example, leaves ePHI vulnerable during transmission over networks, while failing to encrypt data at rest leaves it exposed if physical or logical access to storage media is gained. A comprehensive security strategy necessitates addressing both. The professional reasoning process for such situations involves a thorough risk assessment to identify vulnerabilities and threats to ePHI. This assessment should inform the selection of appropriate technical safeguards, including encryption algorithms and key management practices that are both effective and compliant with HIPAA. Organizations should consult industry best practices and NIST guidelines, which are often referenced in HIPAA compliance discussions, to inform their decisions. Regular review and updates to security policies and procedures are also crucial to adapt to new threats and technological advancements.